Hi friends, in my previous video I explained healthcare quality briefly. The intent of that video was to make healthcare professionals realize that having a quality management system or implementing healthcare quality standards is not just for earning an accreditation but focus on safer and better patient care. So we must understand that having a QMS or implementing a quality management system in our healthcare setting, the purpose is just to focus on better and safer patient care services, better patient care delivery, and achieving an accreditation is, yes, definitely significant, but that should be secondary. I'm not undermining the importance of an accreditation, but our focus, our priority aim, our priority area is providing safer and better patient care. In this video, I shall be explaining the significance of healthcare quality standards. Let's see the first one. It is clarification of goals and objectives. Every department's goals, objectives, purpose, aims, everything is defined and set out clearly, that too in a documented manner, and the departmental staffs are trained about it. Finally, ultimately, all these departmental goals and objectives are merged towards organization goals and objectives, which is of course patient satisfaction, patient-centric approach. Secondly, a process mapping. An in-depth study of the processes of every department is carried out. Then most importantly, identifying, eliminating, reducing wastes in a healthcare setting, that is wasteful activities in a healthcare setting. A wasteful activity or a waste is something which contributes nothing. It has completely no value. It is completely valueless. It is an activity, it is done, but it has no productive value. Let's say waiting time, longer turnaround times, wrong diagnosis, wrong reports issued and recalled, managing medication errors, managing hospital acquired infections, repeat surgeries, repeat admissions or returns to the hospital, unnecessary longer average length of stay. So all these are wasteful activities. As I said, these activities have expenses behind them. There are expenses incurred, but it doesn't contribute towards the organizational productivity. So such activities in a longer course of time will only increase our cost of operation. Therefore, we must identify such activities and work continuously towards eliminating them. So there is a popular quality tool called the Six Sigma or the DMAIC approach: define, measure, analyze, improve and control. This is a quality improvement tool. In my upcoming videos I shall be explaining this briefly. Then the next one is standard documentation. Let's say that a consent forms, blood transfusion reaction reporting forms, medication reaction reporting forms, any sentinel event or any incident reporting forms. So these are all the important and crucial documents which we should have in place, and a prescription format, medication order format, our departmental SOPs and checklist, audit checklist. These are a few crucial documents which any healthcare setting must have in place, and we must carry out these documentations. So healthcare quality standards clearly list out the documents to be maintained, and of course their format and how these are to be prepared. Then the roles and responsibilities of each and every employee are defined. These are also clearly defined. These are laid down in a documented format, so that in case there is any dispute, the accountability is clearly fixed. The person who is responsible, the person who is at fault, is clearly traced out in order to avoid future discrepancies and all that. Then through all these standards, implementing all these standards, we definitely better and improve the image of the hospitals. So I shall be explaining all these significances in more details in my upcoming videos. Thank you for watching it. Thank you.